Welcome to the HS Foundation second annual patient-focused meeting, Spotlight HS. We are so excited to have you joining us, some of you for a second time, but many of you are here for the first time. This meeting originated to empower and validate people affected by HS in their treatment journey, and we are so pleased to be able to offer it for a second year in a row. Our hope in putting this meeting on is to provide best level evidence and answer your questions here and now. My name is Christine Yannuzzi. I've been an HS patient advocate for about 8 years. I run the HS Warriors Facebook page, and I work for Tono Health as a HS patient advocate. I'd like to go over a little bit of housekeeping before we start. There's a chat section on the right side of the screen. Oh, look at that. It even comes up there with a message. There's a chat section on the right side of the screen. You can use this to chat amongst each other and ask questions that you might have for the speaker. Please keep in mind that we do our best to get to everyone's questions, but due to time restraints, that may not happen. However, there will be committee members in the chat section who may be able to answer your questions. Spamming the chat or any other area of the HS platform is strictly prohibited. If this happens, that individual will be blocked from using the platform. We will not be able to provide answers pertaining to your specific case or loved ones, so keep those answers broad. Well, they're questions, so keep those questions broad. This platform and the content will be available through December 31st, so you can come back and check anytime you'd like. There are so many resources on this platform, including advocacy groups from all around the world. You can find the advocacy group tab on the left side of the screen. Finally, we'd like to give a huge thank you to our sponsors, AbbVie, Novaritis, UCB, and Daveluy for helping to make this possible. Please use the breaks to visit and chat with them in the sponsor section. We're going to kick off these meetings with our first speaker, Dr. Steve Daveluy. He will be busting some HS myths for us. Dr. Daveluy is an associate professor and program director at Wayne State University in Detroit, Michigan. He earned his bachelor's degree in science from Michigan State and completed medical school in his dermatology residence at Wayne State University. He holds special interests in teledermatology, non-invasive skin imaging, skin of color, integrative dermatology, and complex medical dermatology, including HS. He lives across the border in Windsor, Ontario, Canada, with his husband and his very spoiled little dog. Take it away, Dr. Daveluy.
Thank you, Christine. And I think it's so awesome that we start off Spotlight HS with Christine, one of our patient advocates, because it is all about the patients and the people affected by this disease, especially this conference, where we're really trying to raise awareness, help people get that information out about, because we know it is a struggle. And this first topic is one of those things that, unfortunately, anyone affected by HS has probably gone through, is hearing these myths and things that aren't really true and trying to navigate your way. So hopefully we can bust some tonight. We're going to have lots of time at the end for Q&A too, because I'm sure there's other things that you've heard of that I didn't even think about to include. So I put a little picture here. This is an old Greek pot, and it's got, their old myths on it. And this is the myth of the Hydra. And it's this multi-headed monster that's just terrible. And I thought, oh my gosh, how appropriate that this Hydra is this monster. And we're talking about Hidradenitis Suppurativa. And it almost to me kind of looks like one of the heads is attacking an armpit and one is kind of going for the groin there. So I don't know. Maybe that's where the Greek myth came from. I'm not saying that for sure, but who knows? So when we think about myths, especially myths that come into play with medical diagnoses, what are the ingredients for the myth? Well, there's usually a little bit of truth, which is what makes it kind of stay alive. If it was totally false and nothing didn't make sense at all, people wouldn't even talk about it. And then I think there's a little bit of hope that comes into play. A lot of times we believe things that we want to be true. And I think that's why we care about these myths and why we're impacted by them, is because in some ways we either hope part of that they are true or hope something about them will help us. So from here on out, we'll run through the myths. So one that we hear a lot is HS only affects people who are blank. And you can fill in the blank with female, obese, smokers, have poor hygiene, all these things you've probably heard where someone says, oh, you have a disease that affects this or that or that. So there's a little ounce of truth in that it is more common in women in the Western world. It affects women 3 times as much as it does men. There is an increased risk associated with smoking or with being overweight. And the disease can be more severe in those states, but it's definitely not the cause. It's not a prerequisite. You don't have to smoke to get HS. Tons of non-smokers can get HS. And then a lot of healthcare providers don't know about HS. So they say these things, they've kind of read that. So they heard, oh, it's associated with tobacco use. So therefore it's a smoker's disease, but they don't really understand what they're talking about. And hopefully we're going to change that at the HS Foundation, because we're trying to educate healthcare providers, everybody about HS. And then the reality behind this is that HS can affect anyone, men, women, children. It's been reported down below even the age of 9 and 6 and 7-year-olds sometimes. It is more common after puberty or during puberty. It can affect all races. It can affect people who are underweight, overweight. It can affect people who do smoke, who don't smoke. And we don't know the cause. So we don't know what the cause of HS is. So it's definitely not obesity or smoking, because we don't know. We're still trying to figure it out, and it's very complicated. And then the other piece to this that's a reality is that shaming and blaming people is harmful. There's no reason that someone should feel like they got HS, that it's their fault. It is definitely not your fault that you got HS. It has something to do with your immune system, maybe your genetics, maybe the bacteria that live on your skin. Who knows? But it's nothing you did. You didn't give yourself HS. And that's a really important message that we're trying to get to healthcare providers, to say, don't make people feel shameful or blamed for their diagnosis. It's nothing you did. The next myth that we hear quite a bit is HS is an infection. Oh, you have an infection. Your skin's infected. There's a little truth in it, in that bacteria do play a role in HS. We know that the bacteria that are inside the hair follicles and inside the HS lesions, the skin areas affected by HS, are different in people who have HS and people who don't. And it's even different in those areas compared to your other areas of your skin. So we know bacteria play a role. We also have some really interesting recent research that shows it might be the way your immune system is reacting to those bacteria that's causing so much inflammation. And then the other bit of truth is that antibiotics can help. And sometimes the antibiotics actually do kill the bacteria, and maybe those bacteria were stimulating the immune system, so it helps. Other times they actually have a calming effect on the immune system, so they aren't really influencing the bacteria. But those things kind of make people get confused. The other thing is HS, it looks infected. So it's the same parts of the immune system that would react to an infection are the ones that are inflamed in HS. So that's why you have pus, drainage, redness, swelling. It looks like an infection, but it's not. And we know it's not an infection because the reality is it's not contagious. You're not going to give it to anybody. It improves when we calm down the immune system or block the immune system. And if you block the immune system in someone who has an infection, the infection gets worse because your immune system's fighting it. And then we know, like I said, genetics play a role, hormones play a role, the immune system, all these things have a role. So while bacteria play some kind of role, we don't know if the bacteria are triggering the HS or is the HS making an environment where different bacteria grow. So it's a complicated picture, but it's definitely not an infection. It's not contagious. HS is a sweat gland disease is our next myth. So there's an ounce of truth in that you have these certain glands that are called your apocrine glands. They're kind of like your puberty sweat glands. So they're not active before puberty. Then you hit puberty and all of a sudden you get body odor. So they're in your armpits, your chest, your groin, your belly button. So those areas do tend to be the areas that are most commonly affected by HS, but not the only areas that you can get HS. So that kind of led to this confusion that, oh, it must be those glands because they become active at puberty and then HS shows up. So it must be those glands that are the problem. But we know it's actually more a disease of the hair follicles. And that's why you can get it anywhere you have hair follicles, your scalp, your face, your neck, anywhere on your body except your palms and soles can be affected by HS. Hopefully it isn't for most people, but it is possible, which that again lets us know that it's not just a disease of these sweat glands. And this also leads to sometimes people talk about, oh, I had my sweat glands removed and it helped. And you'll even hear doctors say, oh, we're going to remove your sweat glands and that's going to help. But that's not really the truth about it. And I forgot to mention, if you guys have any questions, you can put them in the chat, because I'll be able to see the chat with the questions and we'll be able to go over them later too. It's kind of there's not really a way to sort of raise your hand for questions. And then, like I said, the reality is it involves those areas, but we also know laser hair removal is one of the treatments that can help some people with HS. So it's more a disease of the hair follicle. And then, like I said before, genetics play a role, hormones, the immune system. So it's not just a sweat gland issue. Our next myth, and hopefully this one starts to disappear, is there's no treatment for HS. And sometimes, hopefully, none of you have had to hear this, but it's a sad reality, is that when doctors really didn't know how to treat it, sometimes they would say, oh, when it gets bad enough, you can get surgery for it. And that's the only treatment, is you just wait till it's bad enough and then you get surgery. So there's an ounce of truth in that before 2015, there were no FDA-approved treatments for HS. So officially, there were no treatments. But we have a lot of diseases in dermatology that don't have any approved treatments, and we still know how to treat them. There's still no great treatment that works amazing for everybody, and it's a difficult disease to treat. But we do have treatments. We have one medication that's already FDA approved, some more that will be coming soon. And then we have these North American guidelines. And in the North American guidelines for how to treat HS, which were published a couple years ago, there are 30 medications and 10 surgical procedures. So if anyone ever tells you that there's no treatment for HS, tell them, oh, no. There are 40 treatments at least for HS and more are coming. Is everyone right for you? Maybe not, but there are treatments. So this is a message we're really trying to get out to doctors to say, hey, there are treatments. Just because you don't know them doesn't mean that there aren't other doctors who do know. So get people to an HS specialist, get them to a dermatologist, get them to someone who can help. And then the other good thing is that with all this activity, that HS is finally getting its time to have more attention, more research, and more treatments are coming, which is so exciting. It has been a long time of kind of suffering and trying to figure out what to do. And finally, HS is having its moment, getting new treatments, getting tons of research, and it's just a very inspiring time. This myth actually usually comes from other patients. They say, this worked for me, it'll work for you. This treatment was amazing for me. Go ask your doctor. It's the best thing ever. And the little bit of truth is it did work for that person. You know, that treatment helped them out. And it probably works for other people too. The tough thing is with HS, everyone is different. Treatment response is really unpredictable. Some things work great for one person and don't really do a whole lot for other people. So there's a little bit of trial and error, figuring things out, trying to find out what's going to work for you as opposed to what works for other people. Still, it's not a bad idea if you talk to somebody who tried something and it worked well for them and you think it might be a good fit to talk to your doctor about it. And the other thing is be a little kind to people when they kind of post these things online or tell you they have good intentions. They want to help you. They found something they're excited about and they hope it will work for you. The challenge, I would say, is be careful about doing this yourself online, because the impact can be really devastating for people when they go try the treatment and it doesn't work for them. And then they're kind of stuck with this emotion of, well, it worked so good for them. What's wrong with me that it didn't work? So I would say whenever you're sharing online your successes, just remind people, hey, this worked really well for me. It might be something that you want to talk to your doctor about, but don't necessarily say, this is the best treatment ever, or if you just do this, you'll get better. Speaking of which, kind of the same idea, if I just find the right diet, I can cure my HS. So there's a little truth in that your diet can contribute to inflammation. There's healthier diets and diets that are less healthy and trigger the immune system. Dairy is one of the things we know that can flare HS for a lot of people. Fasting can help. So they did some studies for Muslim patients who fasted during Ramadan, where they didn't eat from from sunrise to sunset. And they noticed that their HS improved with fasting. And we know intermittent fasting is a nice way for the body to shift out of that inflammatory state and kind of go into a healing state while you're fasting. And we also know that for some people, something called brewer's yeast can trigger their HS. And there's been some research to show that brewer's yeast is in baked goods and fermented foods. So there is a truth that the diet can be contributory, but the reality is it may help. It's rare that it's the be all end all and you change your diet and you get miraculously your HS goes away. It's not impossible. It's happened for some people, but for most people, it's a piece of the puzzle. And for some people, it doesn't make a difference. So that's what I usually counsel my patients. I say, hey, here are some of the things that we know can sometimes be related to HS. Dairy, the unhealthy foods like fried foods, sugary foods, high cholesterol foods. Those are a good idea to just avoid anyway, just for your general health. And then the dairy, I say, why don't you try for a while and cut dairy out and see how it does for you? If you aren't sure, after a couple months, eat a lot of dairy and see if you flare up. That might give you a clue too. But I always warn people that it may help, it may not. It's just like everything with HS. There's trial and error trying to figure things out. And we're doing more research into the diet aspect too to see and figure out how we can help more people in that route. And then this is kind of like that last one I said. People think there's just one perfect treatment for me. I just haven't found it yet. And it's a little true because it could be true. There might be one treatment that works perfect for you and you just haven't found it yet. And that's why, like I said, there's sort of trial and error. You got to try things out a little bit and see what you find. And it might be true for some people. They might really have that one thing that works amazing for them. In reality, though, especially if you have moderate to severe disease, in mild disease, it's more likely that you might find one thing that works really well or two things that work really well. But as the disease gets more severe, it gets to be more of a challenge. So for a lot of patients, combinations of treatments are way more typical. And so if you get some improvement with one treatment, we may add on to the regimen. So if one treatment helps you 40%, another one 30%, all of a sudden you're at 70%. We've just got to keep kind of stacking things on safely to get it completely under control. Hope can't help, or hope can help. Be hopeful, be optimistic. There's actually some interesting research that talks about when you start a new treatment, the way you think about it can actually influence how well it works. So if you kind of go into it saying, all right, I'm going to start this treatment and I'm going to see how well it works for me, it might actually work better than if you say, I'm going to try this, but I don't know if it'll work. And it's just your body cooperating and engaging its natural healing systems, as opposed to the stress hormones that are released when you're nervous that something might not work. So hold on to that hope. The only other thing is, don't hold on to hope so much that you're devastated when something doesn't work perfectly. Like I keep saying, it takes a little trial and error. You might have to kiss a few frogs before you find your prince. You might have to end up with a few princes to get you under control. And then, like I said, it's all about expectations. So if you go in knowing that maybe this medication will work, I hope this works really good, but I'll be happy if it just helps me somewhat, then that is much better than saying, I hope it works, and if it doesn't, I give up on it. And just hold out hope that new treatments are coming. There are over 30 medications right now being studied for HS and more in the works. So there's going to be more and more options, and they're getting more and more effective too. So it's good to hold out hope that just because you don't have something that works great for you now, new things are on the horizon. Another myth that commonly comes up is surgery is the only treatment. And this one I kind of alluded to a little bit earlier. So there's a little bit of truth in the sense that surgery can be a treatment for HS, and it can be one of the effective treatments. And there's a few different kinds of surgery. So some people get large areas removed, and that helps if it sort of has already taken over one area of your body. Or there's little surgeries for just one spot or one little tunnel. So there's a variety of surgeries, and they can be really great. I use them a ton in my practice, especially when medications kind of help people and you hit a wall where you still have one spot that's draining or one that just won't go away. Little mini surgeries are perfect for those. The other bit of truth here is that if your doctor isn't aware that there are medical ways to treat HS, they might send you to see a surgeon. Well, surgeons do surgery. So from a surgeon's eyes, they may say, oh, the treatment for HS is surgery. But luckily, our surgery colleagues are recognizing a lot more that it's the best to combine things, to have the medical therapies calm things down, prevent new lesions, and then do the surgery. So we're really working together a lot to have the best outcomes for people, to get their disease calm and then do surgery if they need it. So hopefully no one tells you surgery is the only treatment. And then if somebody does tell you that, it might be time to get a second opinion. This myth is no one understands my HS struggle. The reality here is it can really feel that way. HS can be a very isolating disease. You may not know anybody else who has it. You may have never met anybody with it. It's in areas that you can hide from your friends, family members, loved ones, so no one even knows that you have it. You keep it to yourself. And very few people know what it is. Anybody out there who has HS, I'm sure almost everyone you've told about HS, you have to explain what it is because they haven't heard of it. It's not like psoriasis where they're like, oh yeah, Cyndi Lauper does a commercial for that, right? We're not there with HS yet, but we're working on it. And that's one of the reasons we're doing all this awareness activity, is to get the word out there, to make it so that people have heard of HS. They do know what it is. Most people can't even pronounce Hidradenitis Suppurativa, so that's why we say HS all the time. But I'm here to tell you the reality is you're not alone. Patient support groups are amazing. It is so powerful to connect and talk to other people who are going through something similar to what you are, and to know that you're not alone. You're not the only person going through this. So I highly, highly recommend that you connect with other people who have HS. Some of our sponsors and our patient support groups that are supporting us with this conference are amazing. So make sure to engage with them, get to know people. And for some people, it's even empowering to take it on. Like a lot of our patients advocates have HS. And so the way they've taken ownership of their HS is to turn around and fight back and do good and be a force for positivity. And if that's right for you, that's awesome. We're welcome to have you. If not, it can be inspiring to meet those people. So just make sure you know that you don't have to suffer alone. There are other people who can relate to you, and they can give you all kinds of great tips too about making an emergency kit, how to dress your wounds. Like I can teach you a lot about HS, but you can learn so many things from other people who have experienced HS that I could never start to teach you about. So that's it for the myths that I thought of, but I'm going to kind of scan the chat, and Christine, you're welcome to pop on too if you want to help me field some of these questions.
Sure. So just a quick reminder. First, thank you, Dr. Daveluy. We're going to go ahead and take questions now. So if you want to put those in the chat, we'll try to get to as many as we can. All right. So let's see what we've heard.
I see one off the bat from Melissa. Says, I've had multiple doctors conflicting whether I need laser or total removal with skin graft. What do you do? And that's a really good question. And it kind of came up in the presentation that there's sort of this, you get differing opinions from different doctors. There's this old saying, when you're holding a hammer, everything looks like a nail. And sometimes, unfortunately, that comes into play with doctors and their specialties. So surgeons say surgery is the answer, and medical doctors say medicine's the answer. So it's a little hard to say what would be right exactly for you. One thing that can be helpful is if you go to the HS Foundation website, we have an HS Clinic Finder. And that's where it's HS experts that we have actually looked into, made sure that they know their stuff, they are up to date on all the literature. And if you can, if there's someone near you, and we recognize we need to get more HS experts because there's areas where there's nobody nearby. But if you can find someone nearby, it's nice to kind of talk to one of the experts. There's also some educational materials on the website. So sometimes you can kind of do your own research in the good way, not the kooky person way of I did my own research, but you can actually read up a little bit and figure things out somewhat yourself. And then trust your instincts too. Don't be afraid to read up on HS and then sort of low-key quiz the doctor a little bit and ask them what they think about this or what they think about that, or even ask them why they think that surgery would be better than the other one. And sometimes you can tell from their answer if that's the only thing that they know to do for it, or if they actually kind of know what they're talking about. And trust your gut. With any doctor or healthcare provider, it's good that you have that good connection. So if you feel like one of them you really connect with well, and you feel like they kind of know their stuff, that's the one to go with. But don't be afraid to get a third opinion. And bring up that one said I need this, one said I need that. What do you think I need? But yeah, if you can, try to seek out an HS expert too.
Okay, that's great information. We've got a few more questions here. So we have a couple people asking about the new products that might be coming onto the market. I know you hit on that a little bit, but what else can you
Yes,
say?
it's exciting. There are a lot of treatments being studied. There's one or two that may actually be approved this year and hit the market. And there are many more that are coming out. So it's a really exciting time. We're going to see a lot more treatment options be approved. There's also more research going on for the things that we already use, like some of the antibiotics that we know can help. There's been more research into them, and they're not going to get FDA approved because they're already out there, they're already available, we're using them, but it's still nice to know that more research is going on to confirm these things work. Because sometimes there's been some of the things that we all kind of knew worked because we've had experience with them, but there was technically no study to show that they worked. But yeah, it's a very exciting time. And if you ever want to see the trials that are going on for HS, there's a website called clinicaltrials.gov. It's pretty easy to navigate, and you can type in hidradenitis suppurativa and pop up all the trials that are going on. And then you can even filter it to see what's near you. So if you are kind of stuck and you haven't been able to find a treatment that works well, you can try to see if there's a clinical trial going on to test one of these new medications that might be beneficial for you. And like I said, it's a pretty easy website to navigate. And if nothing else, you can go on there and just be amazed and excited about all the work that's going on right now.
For sure, there is a lot happening right now. Um, so on laser hair removal, we have a question about laser hair removal for skin of color.
Yes, so actually, the most research was done on a laser that's called the ND-YAG hair removal laser, and it's the safest laser for skin of color, and that's where it was actually shown to be beneficial first. So it looks like laser hair removal works in all skin types for HS. Like all treatments, it's a little variable. It doesn't work for everybody, but when it works, it's great. Sometimes it may take a longer treatment course. It's usually like 4 to 6 treatments. It might take a couple extra with darker skin types just to make sure that they're getting the settings exactly right. But yeah, luckily it's available for all skin types. I will say it only works on dark hair because it targets the pigment in the hair. So if you have gray hair, it won't work as well. But luckily, most people with HS have dark hair in the areas that are affected. And even in areas that don't really have noticeable dark hair, like under the breast, it can still be somewhat effective. So we aren't entirely sure exactly how it works, but for a lot of people, it can be a good option.
For sure, and that's a personal experience as well. The lighter hair is more difficult, but we have a couple other questions about biologics. Maybe we can just combine them. Are there any medications that can be used along with biologics? And can you use more than one biologic at a time?
Yeah, so there's a lot of medications, non-biologics, that can be used along with the biologics, and that's pretty typical. For my patients who have more than mild HS, moderate or severe, they're usually on a biologic and something else, even if it's a wash, a topical, sometimes an antibiotic, one of the hormonal type treatments, like the pills that can help HS, antibiotics. So yeah, you can combine treatments with your biologics, and we're actually kind of lucky in the HS space in that most of our treatments for HS can be combined with each other in different forms, which does allow us to kind of create a regimen for a patient and sort of, like I said earlier, add on to things. Now, when it comes to combining biologics, they can block different parts of the immune system. So it can increase your risks associated, just like anytime you take 2 medications, you could have more risk of side effects than if you're taking one. But there are safe ways to combine biologics, and they're actually doing a lot of this with inflammatory bowel disease too, which in a lot of ways is similar to HS. And so I think that may actually be something we see in the future, is either combining two different biologics, or there may be some biologics coming out that target two different cytokines or targets for the biologic. So it's something to talk to your doctor about, just to make sure that it's a safe combination and it would be something that's effective. I will say insurance doesn't love the cost of two biologics. So often we end up combining a biologic with other treatments, non-biologic treatments, or with surgery too. And we don't, that's another good point that we're trying to get out there. There's been research that shows you can continue your biologic through surgery. So if you have surgery, you can keep your biologic going so your disease stays calm before and after the surgery.
Well, that's an interesting point, because we have a patient on here who's reporting that her doctor wants her to stop her biologic 4 weeks before surgery. Do you have any thoughts on that?
Right. So if you can help your doctor find, there's something called the SHARPS trial. And I wish I could remember what it stood for. I know one of the S's is surgery and then the HS, but it was this SHARPS trial that showed it was safe to continue. And I'll double check. If we don't have it on the HS Foundation website, we'll get it up there, because it's a very useful one. Because sometimes the surgeons, they're just trying to be cautious, right? They're nervous that it might cause an increased risk of infection, but we do know that it's totally safe to continue your biologic through your surgery for HS. Of course, you want to talk to your surgeon, but bring that up to them and say, hey, I heard that it's actually safe, and they did research to show that it was safe. So that way they can kind of get up on the latest information. But I recommend it to my patients, because I find that it's best to keep the disease as calm as you can through the surgery.
So we have quite a few more questions about laser, and maybe we can get to those in, we can put some more links about laser hair removal. But there's one I'd like to get to here, and that's comorbidities that are seen in HS.
Yeah, so it's very interesting. We've learned a lot more about HS and comorbidities. And if anyone isn't familiar with that term, that comorbidity is when two diseases kind of happen in the same people. So we do this research to say, oh, wow, did you notice a lot of patients with HS also have arthritis? And then they do research and they show, oh yeah, those two go along with each other more often than not, or than you would expect just out of random chance. So HS has quite a few comorbidities. Some of the big ones are inflammatory bowel disease can go with HS, arthritis. It can have a big mental health impact with depression, anxiety, something we call suicidality, which is, thoughts of suicide. So definitely, if you're suffering with mental health issues, talk to your provider, call a crisis line, because we know it's a tough disease. Other comorbidities are, like I said earlier, obesity, smoking, something we call metabolic syndrome, which is like your risk of heart disease. So HS is an inflammatory disease, and it affects your whole body in the sense that your body is sending these inflammatory signals, and it can affect a lot of different things. So we actually came out with some really great guidelines about, if someone has HS, here's the other things you need to be checking. And of course, acne. I almost forgot acne. Acne can come along with HS, like severe acne, pilonidal cysts, which is basically like the same as HS, but right at the top of the butt crack there. So there's a lot of things that can come along with it. And I think, again, that's a good one. If we don't have that up on the HS Foundation website, and I keep saying that, we have what we call plain language summaries or research summaries, where we take research articles and we put them into layman's terms instead of scientific mumbo jumbo. And we put them on the website so you can read these things and actually understand what the research means. So I'll make sure we have the SHARPS trial up there and the comorbidity guidelines up there, because those are really good questions and good things for everybody to know. And I do know we have some information about comorbidities up on the website.
So we're winding down here, but again, if you guys want more information on the laser hair, these questions will still continue to be answered in chat form. And Dr. Daveluy, since we're doing myths on HS, just to reconfirm that just because you have a comorbidity doesn't mean that one caused the other.
Exactly. That's an excellent point. All we know is that they sort of tend to happen more commonly together, but it doesn't mean one caused the other. We don't even know for sure which one happened first, or were they both caused by something else, and that's why they both showed up together. So that's why we call it a comorbidity. They both happen. Co is like together, so they just show up together sometimes. So it's more about making sure that we're looking for those when we diagnose one. A good example is Down syndrome. People who are born with Down syndrome have a higher risk of HS, but we don't know why exactly, but we just know that then we need to have that conversation with our patients who have Down syndrome to say, hey, if you start getting boils, let me know, because you have a higher risk of getting HS. So yeah, they just happen together, but it doesn't mean it's cause and effect.
All right, so that's actually all we have time for today. There are a lot more questions in the chat. And again, just pay attention to your chat form there. And thank you, Dr. Daveluy. We're going to take a little break. When we come back in about 10 minutes, and we'll have a session about connecting others to HS patients. Thanks, everybody.
Thanks, everybody. Have a great evening.